Good afternoon, everyone. Thank you for taking the time to join us today for our webinar. I'm Dr. Jay Rudd. I'm the owner and surgeon here at Aurora LASIK, and excited to help you understand a procedure that has really revolutionized what we do in ophthalmology. It's allowed people to achieve excellent vision without glasses for reading, as well as their distance vision. I think I'm going to go ahead and start my slideshow and help you all understand a little bit about what we do here. I think I'm on the slideshow. Sorry, I'm not a Zoom proficionado. So I'm going to go ahead and start here with my slideshow and get things rolling. Let's see, resume share. There we go. It says resume share. There we go. All right, perfect. All right, now that I got my technology all set, Aurora LASIK is located in Lacey, Washington. I've actually been here for 7 years now, and we are an office that performs procedures to help people see without glasses. And refractive lens exchange is one of the 5 procedures that we offer, and I'm going to go into a little bit more about what that is today. A little bit about me. Again, I've been here for about 22 years in the Lacey area. Performed over 20,000 vision correction procedures. Been a clinical investigator in many FDA trials. In fact, several of them that investigate the lenses that we use in refractive lens exchange. So I've seen a lot of the ones that don't work and also see the ones that work very well. I did train at the Wills Eye Hospital, which is back in Philadelphia, and then came out here after a year at Moran Eye Center, learning refractive surgery, taking a full year to do a fellowship training in that specialty. We have done several mission trips, taken several of my staff along with my children on trips to India, to Haiti, and Bolivia to perform cataract surgery and refractive surgery on patients in that community. Now, I wouldn't be able to start this without commenting on the team here at Aurora LASIK. It is an amazing team. We have technicians and staff with tremendous amount of experience to help people through the process of understanding their vision and understanding what we can do to help their vision. And you can see from our 5-star reviews, if you go online and check out our Google reviews, we're very proud of the fact that we have all 5-star reviews and many comments saying how the team is what really helped them get through this. So again, I couldn't do this without them, and I want to thank all of them for the hard work they do to make the experience such a wonderful one for our patients. So first, in order to understand how we're going to fix your eyes, I think we all have to understand a little bit about how the eyes work. The eyes are a very complex structure, but you can boil it down to how eyes work in a couple of little steps. One is refractive error, nearsightedness, farsightedness, astigmatism, you've heard of that. Accommodation. Accommodation is something we all take for granted when we're young, when our eye is able to, when we're fully correct into the distance, we're able to focus on things up close. But as each year goes by, our ability to accommodate goes down. That's what we're going to talk about today. We also have a process called neural processing. And neural processing is where we take the images that are focused on your retina and then sent back to your brain, where your brain will then interpret what those images are. So again, that's a quick nutshell of how the eyes work. We're going to really talk a lot about refractive error today, though. Refractive error, again, myopia, which is nearsightedness, hyperopia, which is farsightedness, and people get this confused a lot. Hyperopia is not where you start needing reading glasses. That's presbyopia. Hyperopia is where you need glasses for distance as well as for near, and that's why we think farsightedness is really not a good term for that. So I'm going to show you a little something today to show you how the eye works, kind of draw this out for you. And I'm going to stop the share here for a moment. And I'm not a very good artist, but I do have a small picture here. Let me adjust the camera to touch. A picture that I've drawn of the eyeball. Okay, this is the eyeball cut in half. You've got the cornea, which is up front. You've got the natural lens, which is here in the front half of the eye, and then the retina, which lines the back of the eye. So if you imagine this like a camera, what we do is we have light rays coming into the cornea. So these are light rays coming in. And in order for you to see, the cornea and the lens have to focus the image here on the retina. It's got to be perfectly focused. So if this is too strong, it focuses things in front of the retina, like this. And that means you're nearsighted. That means these structures are too strong for the eye. So we give you some glasses, contact lenses, or we can change the structure of these, either the cornea with LASIK or the lens with lens exchange, in order to move this image back to focus on the retina. Farsightedness is just exactly the opposite. These two structures are too weak for the eye. And so that image is focused, instead of in front of the retina, it's focused behind the retina. So again, we can use glasses, LASIK, or lens procedures in order to change the power of the eye and bring the image back onto the retina. So hopefully that makes a little bit of sense about the farsightedness and nearsightedness. So when that's just for your distance vision, when images are brought closer to your eye, the eye then has to work itself in order to focus the image again on the retina. And that's all done by this natural lens. And so we're going to talk to you today about how that natural lens stops working or doesn't work as well as it should, which is called presbyopia. And we'll talk about that right now. Hopefully that makes sense. If you have any comments or questions, we do have a question and answer section down in Zoom. You can throw in some questions. I'm going to try and keep most of the questions to the end, and then we'll address those as we go along. But feel free to chat or send a question into the question and answer period section. So again, the problem is what we call presbyopia. And that is where the natural lens can no longer accommodate like it used to, can no longer move that image that you're bringing closer to you, can no longer move that image onto the retina so you can see. We hear these kind of complaints all the time. I just don't see like I used to. I rely on my glasses all the time. Or, I mean, like most of us, I can never find my glasses. I had them here, I had them there. I've got probably 30 different pair around the house. That's very common for people with presbyopia. And that is because of a syndrome that we've come up with is called dysfunctional lens syndrome. That is where the lens is starting to become less functional for you and doesn't do what it's supposed to do. Dysfunctional lens syndrome comes in 3 different stages. Dysfunctional lens syndrome stage 1 is where you hit in your early 40s, your human lens can no longer focus, and you start needing bifocals or reading glasses. So that's usually in your 40s and 50s. Then we get into stage 2. DLS stage 2 is where the natural lens not only can't focus up close, so stage 1, plus now you start getting a little bit of opacity in that lens. It starts becoming less clear. So then you have trouble with nighttime driving perhaps, or things just aren't as sharp around the edges. That's dysfunctional lens stage 2. And then stage 3, we don't want to get there. Stage 3 is where you develop a cataract. And this is a cataract, so you may be able to see the eyeball has in the eye, you can see the iris around the edges. The cortical spokes, we call them, they look like spokes on a wheel. That is a dense opacity that light cannot pass through in order for your eye to focus. That's a cataract. That is when insurance starts taking care of your lens procedure. So dysfunctional lens syndrome has a timeline. That timeline typically starts in your 40s. When your arms start getting a little shorter. Your arms you're not able to read like you used to. You start needing reading glasses. Stage 3, typically it's in your 60s, maybe 70s. Some people even are lucky enough to have it extend into their 80s where they get a cataract. But you need to spend 25 to 30 years dealing with reading glasses or bifocals. That's a long time. We think it's something that we can solve now. And that's with refractive lens exchange. Refractive lens exchange is a 10-minute procedure. It's done under topical anesthesia. And it's pretty darn quick recovery. The next day, most people are functioning rather well. I do the refractive lens exchange one eye at a time, and it's done with some mild sedation along with the topical anesthesia. So we give some Valium. I then replace the natural lens with an artificial lens. And again, your recovery is rather quick to where the next day, most people are in their 20/30 or so vision. So doing very well. Now, this little drawing here is something to help remind me that I'm going to describe a lens to you. And I typically do this in the office with my patients. And it's a description that really most people can understand because we all love M&Ms. So if you imagine a little M&M and the M&M is the natural lens, it's sitting in your eye. And that M&M, I peel the top of the M&M shell off. So if you can see here on the drawing, the image to the right is the M&M shell with an opening in the top. And then with the surgery, I remove the chocolate from inside that shell, leaving the shell in place. I then will slide the lens implant into the eye, into that capsule. Works really well. And that M&M or the lens is supported by a structure called the zonule that wraps 360 degrees around the edge of the M&M and holds it in place. So it's held in place by the same structures that held your natural lens. The results, like I said, most people the next day are seeing 20/30 or better. They're able to resume their normal activities that next day. In fact, a lot of people drive themselves in. The most challenging part is the time in between the two eyes. Most people wear their contacts for that week in between, or their contact in the one eye. A lot of people just go without glasses during that time and do just fine. There are some risks. This is a surgery. There is a risk of an infection. There's a risk of swelling of the cornea, swelling of the retina. And we do get some halos at nighttime. And those halos with the lenses we put in will gradually improve. They don't totally go away, but they become much less noticeable where most people do not have issues with them down the road. Now, they're about 5 to 10% of the time, we will need to do some adjustments, some astigmatism correction, maybe some LASIK, in order to correct a little bit of refractive error that's left over, a little bit of the myopia or hyperopia. And that's because our lens calculations are really, really good. However, they're not perfect. And so occasionally we need to do some adjustments, and we all have that as part of the procedure itself. We have tremendous technology that helps us with this as well. While the surgery is done by hand, we have a laser called the femtosecond laser that helps me by opening up that capsule and then also softening the lens in order to help me do the procedure. I then use an ultrasound in order to remove the lens material and slide the lens implant in with the latest advanced technology that's out there. Now, there are different lenses that are out there. And one of the things that we need to do when we see you is we help you decide what lens option that you're going to have. The vast majority of the time, we use the trifocal lens implant, PanOptix, which gives us great distance, intermediate, and near vision. But we also have an extended depth of focus lens. We've got an adjustable lens. And I'm going to go into those in just a minute to tell you about what those different lens options are. The PanOptix lens, by far my favorite lens. Works very well. And again, I've been doing this for 22 years. We have not had a multifocal lens that is as good as this in that time. I used to have to tell patients when we first started doing multifocal lenses that it took 6 months to get their reading. They were not happy with that. With the PanOptix lens, the vast majority of the people are able to read that next day. It is the most common lens for us. You get distance, intermediate, and near vision. Is the only trifocal lens that's out there in the United States. And there's a minimal side effect profile. We talked about those halos, and those halos, they're there. The first couple months, they're the worst, but then they gradually get better to where most people tell me they don't notice much anymore at all. It functions best when both eyes are doing the same thing. So when we have a PanOptix in both eyes, people do really, really well. Occasionally, though, people, maybe they're a truck driver, or maybe they do a lot of night driving up to Seattle. They don't want to have the halos at all. They don't want to deal with it. But then we have a lens called the Vivity lens, which, while it doesn't have 0 halos, it is much less of a chance of a halo than the PanOptix lens. The Vivity lens gives us good distance, gives us good intermediate vision. The problem is its reading is not as good. And so sometimes we can make some adjustments in the two lenses, maybe make one eye a little bit more nearsighted to help the Vivity lens patients see a little bit better up close in their non-dominant eye. But the Vivity lens is typically used for people who want good distance vision and just don't care as much about reading up close, but want to have fewer halos. There is now the most recent option that came out is a wonderful option. It's called the RxSight Light Adjustable Lens. And we use this mostly in patients who've had LASIK before because our calculations, like I said, our calculations are good for the lens implants. However, after having had LASIK, the calculations are a little more difficult. And so maybe instead of 5% of the time, we need to do an adjustment or a retreatment. Maybe 10 or 20% of the time with a one of the other types of lenses. The RxSight lens, light adjustable lens, allows us to put the lens implant in with the same calculations, but then I can adjust the power of that lens when it's inside of the eye. Fascinating technology, really works well to get people the sharpest vision we can get. Now, these are monofocal lenses, meaning single focus lenses. So you'll get a distance lens and you'll get a little bit of you'll get a near lens as well. So one eye distance, one eye near. It is not as much separation as we typically do with monovision if you've ever tried monovision in the past. Really works very well for our post-LASIK patients. Downside is it's a long postoperative course. We do our treatments over a 1 to 2 month period. So again, great option, really exciting to have that available out there for us. Now, we have some frequently asked questions, and some of them may be popping up in the chat. I can't see those right now, but we will answer those shortly. Number one, am I a good candidate? Yeah, that's a tough one. You need to the only way to know if you're a good candidate is to come in and get evaluated. We have to look at the health of your eyes, make sure there's no other medical problems going on. We have to look at your astigmatism. We have to look at the shape of the eye. There are so many factors that go into that it takes a very thorough examination to make sure you're a good candidate. And then how do I know what lens to choose? What we like to do here is I like to sit down with you and find out what your goals are for your vision. What kind of activities you like to do, where you spend most of your time, what's most important to you. When we find that out, then we talk to you about the different lens options and what we think will be the best option to achieve those goals. It is hard for you to choose the lens. I mean, we've seen a lot of people go through this procedure, and we can understand how those people are responding to the different lens types, so we can help you make that decision. How long does it last? I get this question all the time. My glasses change a lot. I need to change this lens out. No, this lens should stay with you for the rest of your life, and it is a lens that should have the same function over the rest of your life. Now, there are some things, unfortunately, that can happen. You can develop medical problems in your eye. You can develop, unfortunately, macular degeneration or glaucoma or something like that. This will not prohibit that. It will not make that chance of that worse or higher, I should say. However, this lens will still allow you to focus, just maybe not as sharply as you used to. You just won't need glasses for the rest of your life. Will you need to change the lens? I mentioned that, like I do my glasses. We do have a small shift in your prescription over time, small shift. Over a 10 to 20 year period, we might have a quarter diopter. That doesn't mean anything to you, but that's one click on our machine. And if it does get to be too much, maybe instead of being 20/20 or 20/25 at 80 years old, typically that doesn't bother them too much, but we could do some LASIK or PRK to try and help sharpen that up at that time. Then we also have, why does my insurance not cover the procedure? Well, insurance covers cataract surgery, so it covers DLS stage 3 surgery. You can certainly wait to have that done. But like I said, there's a 25 to 30, sometimes a 40-year span between when people are in DLS stage 1 and DLS stage 3. So we give you the opportunity with refractive lens exchange to have that procedure and enjoy that vision from your 40s on, rather than waiting until your 70s on. So that answers the should I wait till insurance covers it? And again, that's something we'll have a discussion with you about that. How bad do I think your cataract is? When do we think it's going to get worse? There's really no crystal ball, but we can give you a best guess. And then the most important question for a lot of people is, how much does it cost? And this lens replacement costs about $6,750 per eye. And that includes the surgery facility fee, it includes the lens implant costs, it includes our costs, and that is all inclusive for your, we give you medications as well. We also then can do LASIK afterwards for that if we need to. That's all covered in that fee. So I hope this answered many questions. What is the difference between LASIK and I had a quick question. What is the difference between LASIK and RLE? And I'm going to quickly stop sharing, and I'm going to show you this picture. So remember this picture where we had the cornea here and we had the lens. And in order to move images to focus on your retina, we can either adjust the cornea or we can adjust the lens. LASIK adjusts the cornea, makes the cornea more or less powerful. And that is usually for people who are in their 20s, 30s, 40s, maybe 50s. You know, we start then talking about lens replacement at that point. Lens replacement affects the power of your natural lens, doesn't touch the cornea at all. And so what it does, it replaces the power in here in order to focus that image back on the retina. The reason we do that is because when people get to their 50s, this lens is not working very much anymore. It's starting to get cloudy. Remember, DLS stage 2 had a little cloudiness to your lens as well. And so if we could do LASIK and reshape the things and get the image focused here, it wouldn't allow you to focus up close though. And so LASIK for people in their 40s, we then, we can do LASIK for them, but we have to talk about doing one eye distance, one eye near for monovision. So lens replacement takes LASIK out of the picture. And we just adjust the lens or replace the lens and give you focusing power, both distance and near. Okay. So we have some questions, I believe, and I'm going to leave up. We have also the ability, if you're interested here, I've got our web address, and of course, many of you have that through the links that we sent you. Our phone number as well. Give us a call, and we can help set something up for you to get an evaluation. So just a free evaluation. We take a peek, make sure everything looks good, do a thorough exam, and do all of our testing that we need in order to determine whether you're a candidate or not. And then help you decide if it's right for you. You can also, if you're interested, in the chat, we've got Nicole, our office director, who's here, who's able to help you get your information. We can schedule now if you want as well. So let's look at a few questions. Let me find them in the chat. Where's the Q&A? Okay, great. All right. So thank you so much for the time. I really appreciate you being here today with us. Please give us a call, and we're happy to discuss the lens replacement more for you as well. Someone had PRK question. I'm sorry, we're getting the questions. PRK is very similar to LASIK. It is a procedure that also reshapes the cornea in order to get your eye seeing in the distance. It is, again, typically for people in their 20s, 30s, and 40s, but it is something we can do later if we need to, but it does not address the lens when you get into your 40s and 50s. It is something that reshapes that cornea just like LASIK does. Okay. And thank you all again. I sure do hope to get a chance to meet you and see you better. Thank you.